Abdominal pain, and it seems like there's so many possibilities for abdominal pain, but in the sense of how a doctor treats it, it's actually pretty easy. You always have to. I teach at UIC Medical School, and you always have to go back to the basics as far as problem solving and not having to do $1 million workup on everybody that has belly pain, because it is pretty frequent in the community. So I put together my illustration of a belly. So this is the belly, this is the thigh, and these are all the inner contents, the innards. And to narrow down the possibilities of what could be going on, we go by something called old carts. Old carts. And different medical schools probably have their variations to it, but in all the medical schools in the US, I think this is pretty well known. So old carts is an acronym. It stands for onset, location, duration, characteristics, alleviating and aggravating factors, and then treatment. That's old carts. So you'll find that your doctors, whether primary care or specialty services, will go down the line. Unless this is a real common thing. I mean, if you come to see me, you always have reflux during the holiday season, and you have it again, I'm going to tell you it's probably reflux. I would probably still want to poke and prod and make sure that it's nothing new, because that's where the diagnosis has to be taken with a grain of salt. We can't just always blame the same thing, because sometimes, even if it's innocent, they could be signs that the body is telling you to tell me. And usually the body is very good at taking care of itself, but we just learn to turn off our earmuffs to the signs and the sounds and the symptoms. So I always have to be a lifeguard, and if I'm the lifeguard, if I see somebody waving in the water, I'm not going to interpret that as, hey, that's fun. I'm going to have to think in the back of my mind, is that person in distress? So when people come in to see me, I'll calmly think worst case scenario, but I'll work my way down. So first does it necessitate going to the ER? And that sometimes depends on if I'm open. If there's a telephone call midnight and it seems to be getting worse, and I don't know you, I'd probably say I don't trust the fact that we're going to communicate over the phone. Need to have somebody of a physician or a nurse practitioner put their hands on you and kind of get a feel and get a look at how you're doing. I have a lot of stoic guys that come in and say, I'm not in pain, and you press on the belly and it is totally rock hard, which indicates there's something acute going on. Even though they're stoic, they might be tolerant to pain, but again, it has to be, the treatment is necessitated by my knowledge of the individual. So it's always important, whether it's me or your doctor or a nurse practitioner in a take care clinic, that we figure out, is this an emergency? And if it's not an emergency, and we can go through that with questions, severity of pain, crescendo type symptoms, then we can work up at our leisure with the convenience of blood testing, imaging tests, maybe specialty services, and sometimes even a trial of what to do. There's a lot of great things that are over the counter now, and sometimes if you have access to them, we just do a trial. As long as we get that this, through the questions and answers, is a benign thing. If somebody has 10 out of 10 pain, or if it's crescendoing, it's getting worse, I don't think it's worth doing all the workup and the trial. I think we should get hands-on or get blood testing immediately. If you go to the emergency room, not everybody gets a CT scan of the belly. When you have precancer, not everybody gets a PET scan. Although it would be nice if I was having a precancer or a heart attack, I'd go for the $1 million workup, but I'd have to get a big paycheck to pay for that, and I don't have a big paycheck. So ideally, we have to be choosy with which tests we order. Otherwise, the government will go bankrupt. Well, technically, it's going bankrupt already, but and you can't just order everything. So anyway, it has to be selective, and that's again why we have to ask history. So when Joy comes in to see me and we have right lower quadrant pain, that means on the right side, the low part, I have to think, what's down in that area? And this is the way doctors think. You think what's in the area, and even if it's mild and not severe, you always have to worry about the appendix, because the appendix is in the right lower quadrant in the majority of people that walk in. And if there's right lower quadrant pain and it's crescendoing, meaning it's getting worse and worse and worse, that's not good. A blood test would be important, and then a reevaluation, intermittent reevaluation. And that's the way we used to do it in the Philippines, is you get a blood test like a CBC repeated every couple hours, feel the belly every couple hours, and you just watch. Since I've been in medical school and I graduated in '89, CTs are abundant in every hospital, every urgent care center, so you can actually get a CT scan and get a quick peek. So nowadays you get blood tests, you get a CT scan, it's told, it's revealed right then and there. But again, not everybody can afford a CT scan. That's about a $2,500 test. And it'd be great if we can just order them, but they're not that cheap. So we have to be selective. The other things that are in the area are also the cecum, that's the small intestine where it meets the large intestine. Sometimes the ovary, this is an ovary over here, that's painful too. There's something called Mittelschmerz with women, and it's right as ovulation occurs. There's usually going to be an egg that comes off of one ovary or another, and because the egg is launched from the ovary, it makes its way through the uterus to meet with the sperm and all that other stuff, but as it launches away from the ovary, you'll have a little bit of blood and pain and inflammation. That can be painful on the right side as well. The other thing is the kidneys. The kidneys are back here. I had to draw them back here. They're actually sitting behind, they're retroperitoneal. They're behind the liver, behind the spleen. But in this case, it could be a kidney that's letting go of a kidney stone. And sometimes when you come in and it's severe, we'll get a CT scan, no contrast. And lo and behold, you see a kidney stone. That's what the problem is. But there are some folks who have and pass kidney stones, so that by the time they get the CT scan, there's nothing there. We just have to look at the urine test, and that's where blood and urine sampling would be important, because a blood test will tell you whether there's a chronic infection or the body is really inflamed. A urine test will tell you whether there's blood in the pee. So blood is always supposed to be normal. It's not supposed to be in everything. It's not supposed to be in the colon or the stool. It's not supposed to be in the urine. So it's an easy way to get access to the functioning of a system. So whenever we have belly pain, one of the easiest things to do is, aside from getting the history, is perhaps getting a urine sample to see if there's any blood or white blood cells in the urine. Because if there is, you can narrow it down to one system. That would be the urine and or kidneys and bladder. So if there's blood and or white blood cells in the urine sample, we got it. It's a very valuable test, and it kind of rules in or rules out that system. There's many different systems in the belly. So if it's the urogenital system, we'll at least get a urine sample and rule it out. If it's a colon or digestive system issue, sometimes the colon and the small intestine, sometimes even the stomach, will give a telltale sign of positive blood test in the stool. And yes, you got to get a rectal exam. A rectal exam will give you a lot of great information by checking for microscopic blood in your stool. It's an easy test. It's immediate. You can get some results. It's not perfect, and sometimes depending on what you had for dinner, beets, red meat, other things, citrus, you might turn the test positive. Then you'd have to go for imaging tests or further tests in blood to confirm or denounce a gastrointestinal problem. But more importantly than the test, again, the trial would be if we can elicit the history that, say, the pain in the belly gets worse with eating. Naturally, you think it's going to be from the digestive system, and the digestive system is huge in the belly. You got the stomach. And I put the #1 reason that most people see me is going to be GERD or reflux, acid. We're just really abusing our diets. The standard American diet, it's got low fiber, it's got a highly processed food assembly line that's going right into the body, and you're taking all that glue, all that protein or carbohydrate substitute, all those preservatives, all those pesticides, and you're putting them right into your body. And the stomach is pretty good at defending itself every once in a while, but if you're doing that 3 times a day, you're going to pay sooner or later. The bill always comes due. So mind yourself, but sometimes if we can assume, or not assume, but elicit that I have pain within 30 minutes of eating my food, and it's all in the upper epigastric area versus the lower quadrant, then I can narrow it down to the belly. The belly pain is being stomach, and or acid, and or ulcer, and or reflux. If you have pain in the belly, especially when you lie down, well, that's obvious, that's reflux. But sometimes it's not as easy as that. If you have pain an hour after, then sometimes it can be this little gallbladder. The gallbladder is a little sac. It stores bile made by the liver. And when you eat a fatty meal, or a crappy meal sometimes, the bile has to be extruded out of the gallbladder with a contraction, and it gets mixed into the small intestine where it meets the food coming down. And has a stone or a spiky stone exists in that little bag. Once it contracts, and it's almost like closing your hand on a spike. It hurts, and you'll have right upper quadrant pain. So that happens a short time after eating. Not exactly like an ulcer, which is about 30 minutes, but it could be an hour to a couple hours afterward, and that would be gallbladder. Usually something called a motor meal is a trial. A motor meal would cause pain. The trial would be avoid motor meals or fatty meals. Fatty meals are what cause this gallbladder to contract, because you need bile to break up the fat. It turns it into micelles, and it makes it absorbed. So other things that it could be, if it's left, that's a little unusual. Again, we talked about reflux, acid, ulcers. We talked about gallstones. We didn't talk about up on the left side. Up on the left side, you can actually have a stomach that's kind of sitting up there. So it could be, again, the same things as the epigastric, but it could also be a spleen. This is a spleen up here. I've had two people in about 20 years with a spleen that's a problem. Most of my young folks with mono will have spleens that are enlarged and very fragile. And because they're enlarged, they stretch. Because they stretch real fast from the mononucleosis infection, it hurts. Kind of like a fat lip. It can stretch, and it'll be painful as it stretches. After a while, you get used to it, no big deal. Same thing with the spleen. So I've had one guy with a spleen that had some kind of lesion in it. We still haven't figured it out. It wasn't a cancer, but really weird. However, enlarged spleens can also cause pain. A cracked spleen or a traumatic spleen can also cause pain. If it's enlarged in, say, a football player that didn't tell me he had mono, he didn't tell me he had belly pain because he didn't want to be pulled out of the game, then he takes a hit, that thing's going to crack. That's a ruptured spleen. That will cause death if it's not taken out or stopped immediately. So CT scan again. There's also this pancreas that sits back here, but pancreas, unless you imbibe too much alcohol, doesn't give too many problems. That's why pancreatic cancer, as it grows, by the time you feel it, it's way too big and it's invaded everything. It's sometimes too late. That's what my mom passed away from. But the other things, left lower quadrant, other possibility. You've got the sigmoid colon, which stores poop, and sometimes diverticuli, little pouches that are inside this sigmoid colon or descending colon, can cause diverticulitis. Colitis can also be there if you don't have any of those little pouches. As you get older, you get pouches. I guess you can call it little tiny cul-de-sacs where tiny seeds get stuck. And weird as enough as it seems, the treatment is the trial of avoiding seeded foods, but that would be mostly vegetables and fruits. And if you avoid vegetables and fruits, you're avoiding a lot of fiber. When you avoid fiber, you get constipated and you get another problem. And really, fiber, I think, even you paleo guys who try to avoid fiber and grain, that's fine if it works for you. But if you look at population studies, all the longest lived populations always include grain and fiber. And I think fiber is healthy to pull out cholesterol, lower sugar. So I think it's important. But if you do have diverticulitis, diverticulosis, you might have to temporarily avoid those things or those kind of foods. Colitis can also cause problems. That's irritation, inflammation to the colon, anywhere along the line here. And then there's also the left ovary. There's also the left ureter. Those are both on the left side. In addition to the pelvis or the suprapubic area. That's localized over the bladder, over the uterus, and in men, sometimes over the prostate, although the prostate's deeper down. But that's kind of hallmark is going to be urinary tract infection. I put that as the number 4 reason that most people come in to see me for belly pain. Urinary tract infection, again, it's so easy because you'll have the history that I have to pee every half hour, nothing comes out, I've got blood in my pee, or foul smelling pee. That's if you're a woman. And males, they'll sometimes have to pee. Males don't usually get urinary tract infections, they get sexually transmitted diseases, but they can have belly pain in the front, right in the suprapubic area. They'll have pain with urination, sometimes discharge from the penis, and positive contact within the last week. More common than that, less common than reflux and stomach issues would be irritable bowel syndrome or inflammatory bowel disease. And that's where you have central pain, like belly button pain. That's where the small intestine sits. And unfortunately, that's a whole constellation of problems, but usually you'll have bloating, and I've given talks on why bloat occurs because of either an allergy to a food group or an irritation to a food group or a parasite of some sort, or too much alcohol, too much coffee. But there's the bloat that occurs. There's irregularity and digestion pain. And that's a gnawing pain because this small intestine is all curled up here. That's the longest portion of that digestive tract. Digestive tract goes to about 32 feet from mouth to butt. And most of it is right here in the small intestine. Small intestine is so important for absorbing every macronutrient, most vitamins, every supplement from your food source. That's why it's got to be long and slow. But remember, if you're irritated and this pacemaker doesn't like what's going on with it, it's going to get rid of the hot potato. So the problem would be if the pacemaker, which is the stomach, it's a pacemaker to this long, convoluted digestive tract, pacemaker is unhappy, it's going to either shoot the food that you ate back up and make you vomit, nauseated, or it's going to shoot the food down, undigested, because it didn't like it. But the hot potato is there because if it's undigested and shoots it down, it just gave undigested food to the small intestine. Small intestine doesn't want to deal with it. They're very delicate, it's a very delicate organ system, and it's supposed to just absorb slowly, not have too much bacteria in the surrounding. But if you have this undigested food with a ton of bacteria, it's got to say, how am I going to digest this? I'm not going to do it. I'm going to bloat. It goes from garden hose size to fire hose size. And that just makes you gain size. I've seen people go up about 2 pant sizes just from the bloat from the small intestine. And if the small intestine tries to get rid of it fast, it's going to push everything else out of the way. That's why irritation in the stomach is going to make you poop and dump real fast. Because if the small intestine doesn't like it, it's going to hand off and it's past the hot potato to the colon. But you got to make it through that twisty thing. It's about 23 feet. It takes a while to get there, unless you're really on fire and or you have, say, an E. coli infection, a cholera infection, amoebiasis, dysentery. You're going to have this small intestine that's muscle, and it's going to project everything through it real quick. It's going to present that undigested food with a whole bunch of bad bacteria into the colon. And the colon is supposed to be for storage. Colon's going to say, what? I'm not going to deal with all this because unfortunately your bacterial load, majority of it, sits in the colon. That's the healthy bacteria that's responsible for feeding a little bit. And guess what bacteria, which are probiotics, need? They need fiber. So you guys that are avoiding fiber, please don't do that too long. But if all these bacteria suddenly have a whole bunch of undigested food, that's just candy for all these bacteria, especially the harsh ones. Remember, there's multiple species. There's multiple species that exist in here, and they're in balance, including yeast. But when you feed or you happen to present the wrong type of food to the wrong bacteria, even if it's just a minimal amount of bacteria, the wrong bacteria will suddenly bloom, or the yeast will bloom, and then you'll have a problem with overgrowth, and that's not good. So, and you'll get then you'll have pain from, or ileus from the colon, and you might even have blood coming out the poop. But everything dumps, and I did a tutorial I think there was a question by Joe on what happens when you have dumping or diarrhea. So look into that tutorial, or actually it's not a tutorial, it's a question. So that's usually the way we kind of digest. A couple other things that might exist too are the ovaries, and if we've ruled out any digestive issues, Could be reproductive. Then the ovaries, if it were a perfect world, you'd have pain at a certain time of the month and it would be rock solid normal. But unfortunately with stress, polycystic ovarian syndrome or endometriosis that some women get, that's mostly just inflammation. And it's terrible inflammation. It can hit anytime it wants. Stress, no stress, food, no food, period, no period. It'll just decide whenever. The endometriosis, typically it flares pain up during the time that you have menstruation because it's a tissue that comes from the endometrium that's displaced somewhere else. There's even been in history some stories of endometrial tissue being placed or migrating up into the nose so that every time you'd have bleeding from your uterus, you don't have a bloody nose. And that's rare. But it can be polycystic ovarian syndrome, which I think has a lot to do with low iodine levels, but it could be that. There's ways to take care of that. A trial of avoiding certain foods, low glycemic index foods, inflammatory foods, nightshade foods, all would be helpful. Sometimes if you can't do the trial because you have so many things going on, because I have a lot of fibromyalgia patients that have all these things going on, and it's hard to sort out. I think I did a question from Jessica on polysystem dysfunction. Sometimes if you can't figure out which system, then you just go down the line and you see, okay, which one is most severe, and you take care of that first. You always have to rule out with blood testing, urine testing, sometimes breath testing, imaging tests, CT scans, MRIs, ultrasounds, and then sometimes a scope by a GI specialist. GI specialist is gastrointestinal specialist. Those are the guys that put a scope down the top, put a scope down up from the bottom, or they send a capsule down to a camera capsule to see how the lining looks. If it's not digestive though, you're going to have to see a surgeon, either a surgeon, a general surgeon, or a gynecologic surgeon to do a laparoscopic evaluation. Exploratory lap is sometimes important to see if the lining of this is inflamed, also to see if there is endometriosis and do a treatment plan. So it is important, that's why I put first trial. If you know that it's easy to avoid, then you avoid, or get allergy tested for the foods. If you can't, and it's too confusing, then you have to do the testing as per me or my specialist, then you do everything else like we talked about. So that, in a nutshell, and that's now 20 minutes, but that in a nutshell is what happens when you have belly pain.